As you know, President Obama stressed that he favors requiring everyone to buy health insurance. And additionally, the leading House Health Reform Bill, H.R. 3200, and the Senate Finance Committee plan both include a requirement for everyone to buy health insurance or pay a tax penalty. But, and this is a really big but, in addition to making everyone buy health insurance, the bills also require private insurance companies to comply with the government's administrative simplification rules in order to be a qualified seller of insurance. This is a very important dot to connect here, and let me explain a little bit about the federal government's, quote, administrative simplification system. Okay, administrative simplification is a system of linking and exchanging electronic data nationwide. The concept dates back to the original Clinton Health Plan of 1993, and even though that plan was never passed, a section of the bill, when you go and look at the original Clinton Health Care bill, the actual legislative language, you'll see in there a section titled, quote, administrative simplification. That section of law was inserted into the 1996 Health Insurance Portability and Accountability Act, known as HIPAA, which did become law. And over the years, both the Clinton and the Bush healthcare administrations have supported the concept of administrative simplification. In fact, President Bush is the one who set a timeline for everyone to have and use electronic health records by 2014, which the economic stimulus bill that's now law included that provision that plans for everyone to use and have electronic health records by 2014. Well, today the leading House and Senate health reform bills both build on HIPAA's administrative simplification rules. The House bill, H.R. 3200, includes a section that calls on the federal government to do the following. And I quote here, enable the real-time or near real-time determination of an individual's financial responsibility at the point of service, and to the extent possible prior to service, including whether the individual is eligible for a specific service with a specific physician at a specific facility, which may include utilization of a machine-readable health plan beneficiary identification card. In other words, the federal government would require everyone to buy acceptable health insurance and then give both government and private insurance companies real-time access to everyone's financial and health-related data in order to make determinations about everyone's ability to pay, and actually also whether anyone can even see and receive service from a specific physician in the first place. What's more, the Senate Finance Committee's plan also requires health plans to comply with the federal administrative simplification rules, and it creates, quote, unique health plan identifiers. That means every health plan would have to have an ID number, and all of you are going to have a health plan ID number for your health plan. The Senate plan also would establish a penalty fee for insurance plans that don't comply with the rules to exchange data electronically. Now, if you wrote Congress and voiced your concerns about this issue, I guarantee you would receive a letter, something like this, that would say, oh, don't worry about your privacy with administrative simplification because we have the HIPAA privacy rule. Now, how many of you have received the HIPAA privacy notices? A few. Okay. How many people have read them? No one. Don't worry, you're not alone. You're not alone. Really, nobody has time. You're not guilty. You're innocent. It's not your fault. Really, 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 you're not. And people just don't have time. It says, your privacy notice, oh, that sounds good, great, go on, go get your care. But if you actually took time to read those notices, you would be astonished at what they do. HIPAA is probably one of the least understood health policies. The HIPAA privacy rule is one of the least understood health policies in the United States. Most busy people don't have time to read the fine print in the HIPAA privacy notices, and even many members of Congress and their staff aren't aware of what the HIPAA privacy rule legally permits. And I've actually read all the versions of the HIPAA privacy rule. The initial one that was proposed during the Clinton administration, it took me about 4 weeks, very part-time, with an attorney, cross-referencing every exception So I'm going to share a few details about this HIPAA privacy rule. It actually legally permits, the HIPAA privacy rule legally permits everyone's personal health information, including genetic information, to be tagged, tracked, and shared with more than 600,000 organizations for many purposes without patients' consent. The 600,000 organizations include insurers, government agencies, hospitals, doctors' offices. And it's not, we're not talking about the media, we're not talking about your neighbor, but it's a lot of people that will have access without your consent. In fact, the HIPAA privacy rule gives the Federal Secretary of Health and Human Services the legal right to access every citizen's health information, including psychotherapy notes, without the individual's authorization. That's what the HIPAA privacy rule does right now. And keep in mind, people might feel safe, they might like certain officials that are in office right now, but I like pointing out that the players change over time, and so we really need to stop and question, do we want any politician having that much authority and access to people's records? Yet, at the same time as I tell you about this lack of privacy, it's well acknowledged that health privacy is essential to receiving quality health care. Even the federal government acknowledges this. And I have to say, in drafting the HIPAA privacy rule, the U.S. Department of Health and Human Services actually did a pretty good job of diagnosing the problem. They know people care about privacy. They just didn't come up with a good solution. And they included this quote in the regulations. They said here, in short, the entire healthcare system is built upon the willingness of individuals to share the most intimate details of their lives with their healthcare providers. The need for privacy of health information in particular has long been recognized as critical to the delivery of needed medical care. More than anything else, the relationship between a patient and a clinician is based on trust. HHS goes on to note, individuals cannot be expected to share the most intimate details of their lives unless they have confidence that such information will not be used or shared inappropriately. Well, I think many of you would agree that in a free society, individuals and not the federal government should be the ones determining and setting the terms for exchanging personal health information. Some people with chronic conditions, they're so tired of filling out forms, they're so willing to put everything online. Other people, I don't know why, I can tell you some people are very privacy conscious. When they call me with these concerns, my first question is not, why do you care about privacy? I end up a lot of times hearing a lot of issues, but I don't ask. I figure privacy is a concern of yours. I just will help you understand what the rule and law, the law is. But clearly, there's a whole wide range of preferences for privacy. But in order to uphold the freedom to make your own terms of contract, I would argue, we'd have to make sure that an insurance mandate is not passed. Definitely not the way that it's being proposed in the current bills. And also that the administrative simplification privacy rule needs to be gutted. It really needs to be repealed. And fortunately, I know this is heavy and it's not the best news, but I can end with a little bit of good news. Fortunately, Congressman Ron Paul has introduced legislation to restore and protect Americans' health privacy. In May, Congressman Paul introduced H.R. 2630, titled Protect Patients and Physicians Privacy Act. And by the way, he is an OBGYN physician. He really understands privacy. I've had private meetings with him, and he said he's taking care of patients who would say, please don't put certain things in my record. So he really understands the need for privacy.